Hi guys, so just a technique video to go through closing diastema with composite bonding. First thing to know is that there are so many different ways out there. If you look at YouTube, Instagram, and also go on different courses, people will teach different methodologies and they all work obviously. I'm going to go through a method which is very predictable in my own hands after having tried different variations of methods. This is something that is my go-to technique. I'm going to go through that with you guys. If you go through this case here, you can see that there's multiple diastemas, but we're just going to focus on the middle one for now. What you want is to have a complete diastema closure. You want the contact with the composite to be around here, right? So the composite should meet here so that you have absolutely closed the diastema. There's no black triangles. Now for that to happen, your composite is going to need to come here like that and like that, which is gonna look a little bit strange if you think about the emergence profile of the tooth, and you're gonna create a plaque trap as well, and the papilla isn't gonna look very healthy and it's gonna be all inflamed and everything. Instead, what you want is actually for your diastema closure to follow the contact of the tooth, your contact to be here and here, and it almost looks like that the composite comes out seamlessly, so that you get a very nice closure of the diastema and it all looks natural and looks part of the tooth. For that to happen, you need access subgingivally. So this is what you do. You get a rubber dam on and you use floss ties to here to really pull the gingiva down and keep it there. As you can see, if you look here and now you look here, look how much retraction of the papilla you've got. If you look here, you can even see some subgingival calculus compared to here. So this is such an effective way to get A, very good moisture control, and then B, obviously have access subgingivally, so you can create your contact and emergence profile in an ideal way. So for example, if you were to go back to this picture and we said we want our contact here so that the emergence is really nice and natural. Well, look here, translated onto this picture now with the papilla gone, that contact is actually around about here, and you're not struggling with bleeding gums or the gums getting in the way, and you've got really good access to create this emergence in this way, and you have got this area where you can then clean properly, polish properly, so that you have no gingival issues going forward. So if you go to the next slide here, we can see that we've got really nice diastema closures. Looks very natural and it follows the emergence of the tooth. You haven't got any acute angles there, and you've got complete diastema closure, and the contact is just sitting just below the papilla there, and it's really highly polished because here I can get my instruments and I can get my composite polishing strips in there to polish really well, so you're not going to have issues with gingivitis. So that is a very effective and predictable way to close diastemas, to use rubber dam and floss ties to give yourself really good area to work in. Once you have the floss ties on, you pull it down so it's nice and tight, otherwise your rubber dam would rise up and that defeats the point of getting retraction in the first place. And then you tie these to your rubber dam frame. So imagine the rubber dam frame is around here. You tie all these floss there and you keep it there, and that gives you a really nice clean area to be working on. So look at another case. This is a really small diastema here. So imagine your papilla at the moment is here, right, and the diastema it's actually got a lot of staining in there, but it's something like that. It's a very small one. You want your composite to kind of just sit underneath there, so it follows this emergence profile of the tooth, and you can get a nice long contact point there. In order to do that, you need to pull the gingiva down. That's exactly what we've done. Now, really top tip here is that you mark where the papilla was before you put the rubber dam on. So you can see this is where the papilla was, and this is how much retraction I've got. Now I know that I need my contact point to be just underneath the papilla, so I want the contact point to be around here, which means that visually I can now plan for my contact point to be there, so when I put my composite there, I can use my size 12 scalpel blade and my polishing strips to really get in there and give it a really good polish to make sure that my gingiva is happy and healthy when I put my composite on. Another thing I want to talk about is how you actually place the composite. So imagine you've got your papilla, you've done your floss, and now you've built up your composite. Now what would happen most of the time is you will overbuild your composite because you haven't really got a stable opposing wall of the tooth to build against. But that's okay. At the moment you're just focusing on getting a really smooth gingival and cervical profile of the tooth and getting it to look nice. So imagine where the white line is, this is where your composite is, and you've kind of overbuilt it. What you then need to do is set the patient up. This is very, very important. You never make adjustments like midline or incise the lens with the patient lying back down because you haven't got good perception. What you need to do is set the patient up so you're looking at the patient front on. You use this dip of the papilla as your reference for the midline. So you know your midline is going to be here, so you're going to need to trim away some of that composite, all of this composite, so that you have a nice straight midline. And the way you do that is using a softless disc. I like to use a medium grit or even a fine grit here, just because if you use a coarse, there's a tendency that you might overdo it and then you have to go back on yourself and it just ruins the case. So I used a very fine one and just gently just disc away a little bit until I'm happy that it looks bang on straight, looking straight ahead at the patient. If you don't do that, you can end up with a midline that's canted, and I'm going to show you a case where I've made that mistake before, and you have to go back on yourself and correct it, which is just long. So once you've done that, once you've built up one of the two, you then use a size 12 blade to clean and polish there. And now for when you're building up this tooth here, you're just going to put your mylar strip here. Imagine you put your mylar strip here, and then you're just going to do a mylar pull through technique, which you can go through another video. This is a staple for when you're doing composite bonding, especially diastema closures. This blade is so important because this little hook here can just tuck into subgingival region here like a hook, and you can use your hand, the sharpness of the blade, to just chisel away at the composite, making sure you don't have any overhangs and you've got a nice profile, and also you don't have any residue of the bond left over. Once you've done that, here we go, that's the case now. It's a very small diastema, it's not a big case, but it's a case that I've documented, and I can sort of do a talk through. Then you can see here that the gum is a little bit angry because we've used the blade just to clean it, and obviously we expect this to heal up perfectly and you get an absolutely perfect complete closure of your diastema and really happy soft tissue. Okay, that's the final point. We will now talk about line angles, because line angles are really important when it comes to diastemas, because with line angles you can make teeth look wider or narrower depending on what you do with them. Line angles on a normal tooth is when you have got this is where light hits and reflects off the tooth. So imagine a normal tooth, this is where your line angle, mesial line angle is a lot straighter, the distal line angle is a little bit curved. So imagine if you're trying to make a tooth look wider for whatever reason, what you need to do is, if this is your tooth, what you need to do, instead of having the line angles like this, if you're trying to make something look wider, you need to push those line angles out like that, and that is going to give an illusion of the tooth being wider than it actually is. So if you're ever trying to make a tooth look wider, this is what you do. This is particularly important when you're doing peg laterals, because your peg laterals, and if you haven't got enough space, you want to make it look wider, you push the line angles out. In the same way, when it comes to diastema closures, what's really important here with the diastema, you're obviously going to make the teeth a bit wider because you're adding the composites. You want to make the tooth look a little bit narrower. So compared to this, you're going to push the line angles in to make the tooth look narrower. So what you're going to do is you're going to push the line angle here, and I'm going to push it here, and you're going to use your softless disc in this area here, just to get this area to all curve around, never touching the line. And what's going to happen is when the light hits the tooth, it's going to reflect back and give an illusion of the tooth being narrow. This is very, very important when you've got diastema's, and especially when you've got asymmetrical diastema's, which means that you've got the space distribution with the diastema's is not equal, such as this case here. As you can see, there's no diastema here or here, but there are here and here. So you're going to end up with teeth which are looking very funny, and everything is sized differently if you don't play around with the line angle. So in this case, for example, again, this is a bigger diastema. Now if you're planning this in your head, I want the contact point to be around about here, so that this tooth comes up nicely, this tooth comes up nicely, and they kind of meet somewhere around here, and then you can follow the line here, you can follow the line here. In order to get access subgingivally, I need to pull that papilla down using rubber dam and floss ties, so that I can actually access those areas and polish them really well. If you went ahead and did it without the rubber dam, in this case what will happen is you will have a contact point here, you will have a contact point here, and you're going to get a weird tooth that looks like this. Right? And as you can imagine, this is just the bacteria, and the food is going to have a party here. Your gum's going to get swollen, patient's going to get gingivitis afterwards, and it's also going to look a little bit off, and it's not going to look nice. The key is you want the contact point just subgingival, but the composite needs to just blend in with the profile, and this is what we call emergence profile. Okay, this is very, very important. So we go to the next slide. Once you got the dam and the floss ties on, you can see I've got loads of space now. A, I've got really good moisture control. B, I've just got lots of space to work with. Now once I've got the dam on, I've kind of shifted the soft tissue lower, haven't I? Which means that now I'm actually aiming to get a contact point above the rubber dam, and I can clean and polish it properly. So if you're looking here, here, and this is what we're going to go for, and I've got good, I can get my strips in there and my blade in there and just polish that properly. So once you've got the composite on, now as we talked about, that we've got asymmetrical gaps here. So playing with line angles becomes so important, because if you imagine this tooth here, I've added a bit of composite like that, and obviously I've got a gap here, so I'm going to have to add a bit of composite here compared to this tooth where there's no gap there. This is a lot wider than that, and the last thing you want in an aesthetic case is for your central teeth to look different sizes. That's just a disaster. But we know they are obviously going to be different sizes if you're not going to do ortho and you're going to just do a camouflage treatment. But we can kind of minimize the risk and get an acceptable looking tooth by just playing with the line angles. So this is what we've done here. We've brought the line angles which were here and here, and we brought them in to the tooth, here and here. My line's a little bit rough here. They shouldn't actually be this rough. Brought them in, which means I'm then going to take my softless disc, and I'm just going to use a medium grit to disc away that part. And what that's going to do is that is going to give an appearance of the teeth being narrower than they actually are. Same thing here. If you see here, normally for a lateral incisor the line angle would be here, but in this case I pushed it here to make this tooth narrower, because this lateral incisor is going to be wider than this lateral incisor, and we want to be as symmetrical as we possibly can. This is where it becomes very, very important to understand line angles and how to play with light. And here, as you can see, the result is obviously not perfect, but it's quite a good result given the compromised situation that we have. The center incisors almost look identical in width, but they're not. We know that this one is bigger medial distal than this one, and this one as well mediodistally is bigger than that, but we can camouflage that effectively, because it might look, this is where the line angle is. Yeah, they're just being brought inwards. Your actual line angle should be more neat like that, and always sit the patient up again when you do this. So sit the patient up when you're drawing your line angles, okay, in this way, that way there, and then you are going to use your medium grit disc to just disc away this part. Do this when the patient is sat up so you can get a good idea of symmetry as well. I generally advocate doing 4 teeth if the diastema is more than 1 or 2 millimeters wider, just because when you're doing 4 teeth you've got a bigger control of the aesthetics of the smile, and you would generally want to make these 2 lateral teeth a little bit wider with some composite. to account for the increase in width of these teeth, so you can get them to look more symmetrical. Let's go through mistakes. So I remember when I said that if you don't sit the patient up and adjust the midline, you're going to get issues like this. Look here, we've got a canted midline here. Yeah, it's not straight. Now sometimes you might just get away with it, but sometimes you won't if the patient is eagle-eyed. In this case I didn't, and the reason was because I didn't sit the patient up and check before. So if I had done that, I would have made sure that I don't get this issue. So I would have done one tooth, sat the patient up, look at it, see that it's not straight, and then get a disc to just make it straight. And then obviously the second tooth you're just conforming and trying to get a contact with the other one. So I hope that my mistake here stops you guys from making that mistake. And then once you do a mistake, obviously you can go back and correct yourself. You got much nicer one there. This picture is slightly at an angle, so it's not very clear. We obviously had to get it back in and then correct it for her by trimming away the composite and then rebuilding the other tooth. Another problem you can also get with diastema closures is black triangles. Now this is actually quite a nice closure I've done. I'm quite happy with the outcome, but if you're eagle-eyed, you'll see that there's a little black triangle there. Now why has that happened? That has happened because I didn't do papillary retraction. Because I didn't do papillary retraction, which meant that when I came to polish my composite, it kind of became a bit like that. And then I ended up getting this little black triangle in this case. Now, like I said, sometimes patients won't notice, or patients wouldn't really care because it's still a big improvement than what they had before. But obviously, the more you do these things, your patient base generally, it depends on your patient base. Some patients are picky and some are not. So it's very important to account for these things. If I had retracted the papilla, I would have been able to get the contact point there as opposed to here, which would have meant I wouldn't have had a black triangle. So don't make that mistake. And again, when you're doing diastemas, again, I haven't made the black triangle. Imagine, you can see there's no black triangles here. Teeth are nicely polished. The teeth look a little bit too wide. So what improvements we can make here is just bring those line angles in a little bit to make the teeth look a little bit slender. So obviously they are going to be a bit wider. I hope that makes sense. I don't want to drag it out too long. There are multiple ways to do this. Some people have their own technique. It's just something that is my go-to technique and I do every time. If I have another case, I will make videos of some other techniques and we can go through that as well. I hope this has been useful for you guys. Thank you.